Muziki ya nai ne takam tera aruka angadat pa disim kalir. Muziki nong tanap sa bushir aser angwer, aser yangchi tuluka. Temasang subut sa simer, arada na alir damjagi, na sushi tumulong achaka ki tanap sa angwut sa yarir. Tana AKASHVANI MOKOKCHUNG, Anava Hospital, Settsu, Dr. Sungti, padan sinsaksam akat sa aralir, anong chi amanger iba sinsaksam achanga, par muziki aser parnuk mapadam tali changjatsa. Hamasa nai mabang akat sa badama kangasa belara, sinsaksam yatin zaka, udang radio angardemi, ano tali changjatsa sushi, nai netenang aser na kuba yimtiba nungi ajitama alam sa daptaksiner.
Thank you. Kinang tenang ya Sungtiakum Jamir ni changki nongi.
Iba sinsaksam din zaka, mezong buba nung, na muzumetater aser temang anap alur ka akamta sushi, lano wanungi techang raba liasa asa, kuma sir iba lamang yashim, iba utsuji tatsagi lamsadap zasa.
Doctor akamza ta profession ya choose asbaya wo. It's not my childhood dreams. Adang ya midang shite. Kidang ya kuno kalisa. Baji titi manam midang lisa. Asnong kidang ji muziki masa doctor khasa titi nang tak baji atok pangu ni. Asa chabur ya family nang isong hawasa medical azong nang chungar da. Ya maji imla lisa de. So nong ke tejang raba ji computer science nang lisa. I was the last kinong bo mazong ji. Nya haidang share azong ba. That is actually kinang medicine field ya iba. So it was not my intention. So nong mi situation ni da mi lamang ya maji lawak so nong chwa azong ade.
Sirano na surgeon ka akamzi da tilimdat pa kuma aki aser iba jia changa ne takam nung kuma anap alu zizizi tangadat pa ta chungba nung rajima hour aser ano tanebu medical officer ka ama inya ka arudang changradam zi akat pa masira ta chang shiba kar lamsadap zasa.
MBBS ya tamer iba kam nung ji MBBS ya tamba kam nung ji kunu yas. Tas nung ni film ni intention medical azang baji pi family atma tanapse or convenience Dr. Khaliza atma akam so nong purpose shi milisa zangzakar so zangamar kishi lamang labok su da seni mission hospital MBBS MBBS tamer warji kinang boss ji urologist Khalisa ibaji ni Assam nong inyak Alipur PMCH hospital nong Silchana sa Taidak si padan iyak pa mawang nung ji surgical field ji ono resource maliba jaka nung surgical hands ji ka tundibang sa liar da rang achita da de so opportunities atok tam ji ko niya surgical field lang pushyaw ji bas nung medicine is something zongteter so nung surgical hands is something nai develop as time nung takar ta sabagi iba nung takpa ang bagi surgical field ji pushyaw Sir, no nikias na kinang experience na experience yung ay galya ni kam ay ga medical missions nung inya Uttar Pradesh, Jharkhand, Uttarakhand, Andhra Pradesh. Ito majak no mabay niya galya ni medical missions no. Utsa tas nung bo ay rang liya. So nung ni lang ha achited pa ji kinang seniors nung ri sayiwa ji. As a doctor, the most important thing is in our profession ji. You take it as a privilege and as an honor to treat people. Ibaji basic principle, you apply it to everyday life. I think that's the only thing I can think of.
Anava Hospital ya labokar kam talangabo masadze saka inyakyam aser hospital facilities nung kangakira ain ba hospital ka asin chila nung lir anong chi ipaya titin zuk nungi tang dashi inyaka aruba mabadam radio angardam din lamsadap taksiner.
Anava Hospital ji, of course, almost 2.5 years complete. So ko, unigibo mamata ako, unigibo tati mabay aroy niya ka hour. Tangari kiji ko malanga sa di ba ji perception ji, unigi chungabo mamata. Tangari bo, iba ji achita dalis ako kako. Naniki unok services ato mas tangar na, kiji sa services. The services ji, kubuzo ka na Switzerland no, alitam 8 years is Switzerland no. Ta unigi achita ba ji unok bo developed country no aliya. That's a developed country, no healthcare facilities. It's a different spectrum, no facilities. That's a pili mayaro, no. It's also a different spectrum. That's no kasaji bo kutanga miyanglo tatawo. So no, what if with the resources that we have, as no nisonga similar experience, ungotet na. Iba te Pilambano Hospital ya labok. Why should we deprive our own people of what people get? Na? That's no iba jiwa vision ka. Lisa da sa tanza. Ashiba ma, it takes time. So unig yangated by sap nung tang da shibo healthcare facilities nung department na nang usually run as a surgical field, gynae, obstetrics, as a unig medicine na bangar. But the idea is to develop it to a tertiary center. Unig na initial vision jiwa. Run it as a secondary unit. Secondary hospital, you have few specialties and you do and then refer them. But in the 2 years, we have realized that many people, they don't want to go travel. So now we have to bring the healthcare to their doorsteps. So we are going in that direction and we'll see how we can do.
Ner muziki tiari akina arordam ayagai hanapsa anguba utsi tachung ashiba angashiuku ano achaka chungzimichi muziki nong department balala bener arwa tiari akatsitsi nepura sushi tipilimba alibaji angasya kanang plara amangar kupi mili idam tiari dam akia outsi yimla atadida mananishi summer. Ano nunuk iba muziki labuktangya nai trabu share sugu sagaudang kichi mangdang ka yurtenzak aser tarutsi nakla kichi lir aji infrastructure tsa sudze misra department dem tasin anir arwa inyaksidam
vision da shis nongbo onok Switzerland nongalidam kubuzukana ki nong sendangi saru MOKOKCHUNG tas nong iba mawang nongji ni incident ka shide onok new market nong sinza sabjialialisa iba aliba mawang noje tsumatser ka dukano amen ka hasnang nanok kung nong yaro kichi mabainya ka da iba ji uchimya adam kubuze ya nok doktora nok Switzerland nolir da shi tas nong layo nok taner bangar dang nok doctor sibla kichi ba pili mai mi pamar kichi ba hospital ka nok khatim demer do options malina ta shi ta iba ji ki kubuze kana nang tumlong nong tira iba ji stir asa de common people there must be a need na Mr. Tapilimba jo milisa MOKOKCHUNG yarzuba. So ibaji say we prayed about it. The vision was to build a place where people can actually have holistic healing. Na? Not only medical is something azungar, we know, so it's knowledge. But holistic healing is also somewhere where people can get a spiritual umbrella that they can encounter healing in a different spectrum. That was a vision. But above all, India government hospital, mission one thing only India achieved the respect to patients. Sometimes I think doctors, we are at fault. We think we are so busy that we don't value that patient. It's just a number. Na? Number 1, 2, 3, so, hospital, we have to be humble enough to treat them like one of us or our own, to make sure that they are attended to in a way we would attend to our parents or our brothers or sisters, irrespective of your caste, your creed, your economic status. So, that they can find a place of healing where they are also treated like not average citizens, but better than average citizens, the way they are treated. Asibeki tunongji Anava shim, Anava, that is a Hebrew word out there. It means humility, gentleness. It also means being at the center of God's purpose and plan. Iba intention no hospital ya labo. That's no infrastructure. So we are in the second phase of our development, which means we are building ICUs, neonatal intensive care units. We are bringing in critical care unit, private rooms. So we are bringing in more specialists. So hopefully by July, God willing, we should have more departments. If the people welcome it with an open heart, maybe we can build on it. Hospital, although it is a social work, it's also a business. And business is something, it depends on the market. If there's a market, it expands. If there's no market, it does not. Iba principle nong dang follow us. Initially, bo nang ipilam, pinisong ay ka join us sa idagi hospital nong. But it didn't happen. Nakanong by Ellen Yamaro, we have advertised everywhere. Spoken to people personally also. So now MOKOKCHUNG, sometimes it's very far off for certain people. So we have changed the approach. So chuko tangali mas no doctors tang arubala. As long as our parents, our brothers and sisters, they don't have to do that extra journey, we'll try to bring healthcare to the doorsteps.
nanuk nuklaji angashidang. It's like God sent nanukji for the people of MOKOKCHUNG and even for all the people of Nagaland. So I think it is a very, very incredible thing, and I hope that God bless you nanuk iba journey nungje. Srano anap aluba tsitsi masira tiari akatsuba tsitsa kichi kuma alaktada nanuki patients adama yarir.
A very difficult question because ni kinang OPD tulong naman na I don't know what happens outside. So no, hospital yatan zaktam kinang employees them interview no arkidam onegi. One thing we stress on is being compassionate and not as a word but as an emotion and as an action. So that is what try na not only inside these four walls but whether it's the housekeeping or the nurses or the lab, that we talk with people with respect. Sometimes we are very harsh. I think that is the only thing I can say, that other than I think you can get healthcare everywhere in the world, but we just try to make them feel at home. That's it.
Muziki da sadangji tsubuzu desam ga samai saka nukina approach ta chongjagi patients kui ga ro parnoga they feel the love and warmth from all the staff members. Srano na kilam nungi patientum anapalu akina arupa ngur mi pa audang naikichi amala tangadat pa masira tamanga nung outsu parnoktang nungi yimlar.
Ni tangali manonga mabayak tam India li mano. As a young doctor unaginang seniors the yashibaje. Doctors facilitate healing, na? But real healing comes only from God. And I think Ibaji is something which I tend to tell patients with the Garadam. Tachong diba muza akazazakok, tachong diba treatment akazazakok. So iba nongji tsangamat nongbo tumuhatsamanguzana. And this is very important. One is I'm a Christian, I'm a believer, so it goes hand in hand with what I do. But I think if you have those belief systems also, it really helps you in receiving healing. Na? It's a matter of faith, you see. God gives you healing if you have faith in Him. We have studied, we know practically what medicine to give and all. But you also have to have enough faith that God will heal them and God will take care of their problems.
Asirano nai no ulan kagi IG reels asunongbo aji a day in my life as a surgeon da ashizakok. Anong jinay udang surgeon kama ke anuko kaji yamay alir da siyalam sadap sasa.
A day in the life of a surgeon, there is nothing like that niyatamo, because primarily and foremost I'm a father and I'm a husband. Na? So if you say tell about your life in a day as a husband and as a father, it's easier. Sakli, na, it starts with shouting, sakang, na, get up, and then getting the child ready for school and getting things organized and all. After that falls the professional part of working as a surgeon. So as a surgeon, we don't operate every day. Na? Once a week or twice a week operate as a, but in doing that, there's more of administrative work, a lot of pushing and pulling, and at the moment, less of being in the theater because there's just so much work to be done.
Sir, a very random question, but you mentioned that your wife is from another country. MOKOKCHUNG nung ara alibaji la susha kumaka, like her experiences baya kuma adapt sa snok award and jikumali award ang trashizasa.
As far as I've seen, I think she's very happy here in MOKOKCHUNG. We don't live in the town, on the outskirts of Alia. So outskirts, life is very simple. No noise, you live in the forest, so you live with nature. So it's for her, she's very happy. Similar to Switzerland. Switzerland, you live with nature, it is quiet, not very noisy. She's very happy. One thing she mentioned about working here, Europe, it's a very demanding job. Because insurance system here and people pay huge amount of money for healthcare, patients are very demanding. Oh, what about this? What about that? And patients are also not very grateful at the end of the day. And here, people are very grateful for the little that are given to them. So because of that, it gives her a lot of contentment. Whatever little she can do, she feels that it's a lot for the people because people are grateful. And I think that is the essence of, even our culture. We are grateful in a way when healing is being given to us.
Kanganang Pilar, Sirano nai nisasa kuda shinung aser tukuluk rinama atar surgery kamakita.
It's like driving. Na? You drive a car every day, so you have a muscle memory in how you turn the wheels and how you change the gear. Surgery is something like that. If you have done it a lot of times, experience now, it's very mechanical in a sense. You know what to do and all. But I think the most important is having a very calm mind. And it's a character thing. Now, calmness, kali nangbo, anything, even if it's stressful, somehow you can perform whatever you're doing without being distracted. And so I think I usually get up in the morning, I have my quiet time, and I'm not a very loud person. I'm quite calm. I think that character is there, so it's not very difficult. And then, of course, you go through the entire surgery in your head 2-3 times before you do it. And I think basically that's it. We have a habit of praying for patients before we operate here. So that we do and rest in God's hand.
Procedure ji ashida surgery sounds very easy, but I'm sure it's a lot of task. Kangabala iba ji share sabadama. Sirano medical officer ka ma nai kichi kuta muziki yimsisiba asir surgical maparindam siritshi takwa inyakteder.
Tangbo, the line is very blurred. A lot of administrative work ji tangbo nong taka because we are still in the primary phase of Tinzakpa hospital here. But it's just only adapter survey. So I might be working, I might be even in the operation theater, but if there's decisions to be made, I'm approachable, so people ask. So we do it. It's very difficult to say how we balance it, but as I said, it's very blurred, the line, but we are doing everything almost every day at the same time.
Asir muziki kaji nisung kagi sengi amandider masil saga medical staff tulungjim aliba achanga takukwa inyakdider. Anungji nai tumayim asir tangadat den kalami achimalwa kuma tulungjim nung panuk achak anir takuk lamang niwa inyakar.
Kubuzukan na iba hospital tanzaktam ya unok interview kidang sakya wade. Uniki intentional decision kayang labaji unok staff ya pili mai ginang akiza. Not against anyone or anything, but the idea of this hospital is also employment, employment generation. So interview akiba mabang no 90% our dangashiza tangyabo. Interview akitam we stress on one thing, and that is how much is your heart in your work. Na? Because no sometimes we are not involved in what we do. It's a job, that's it. But we are not passionate about it. So you have to be passionate about what you do. You have to be willing to do everything and anything because it affects the patient, and we try to lead from the front. One is, it's easy to, 10 years ago, Tamilana, Yasang, Yainyaka, it's very easy. But to be able to lead from the front and let your employees copy what you do is a bit challenging. So as I was saying, that is what we had emphasized on our staff from the beginning, and that's what we also try to do, even practically. We don't believe in scolding, to get work done. We believe in encouraging. And I always tell our staff, you are the face of the hospital, not us actually, because most of the time people see them, not us. And if everyone can identify with the purpose and with the objective of why this hospital was built, then it's very easy for people to see that in the staff. So I can only say that much. We try to lead from the front, lead by example, and we hope that our staff also will follow in the same footsteps.
Nunukama linear kay anya linongbo, I'm pretty sure staffs tamja. They are doing their best because they know that their leader is doing the best for everyone. Sir, tanas ang healthcare system nung naya tatsaktakts team nam tulu tipaji kichi kasidza may pilamer, asir aji kichi tasa achanga kuktitsa ma pilamer.
That's a very important question because there is what we call as commercialization of healthcare. And the fact is, healthcare is a business. It's like running a pawn shop or running a bakery. It's a business. But one thing which we have realized is, if the humanity in healthcare is taken out, it's cold. And healthcare is not meant to be cold. It's to be human, it's to be compassionate, it's to be graceful. And above all, I think you have to be empathetic. That is, you have to be able to feel the pain of the patient. It's very difficult. Commercialization is only a graph and a number. Na perform sang salary akyang yamay. Iba balance it's very difficult because it costs to run a hospital na. And we're always struggling. How do you make it in such a way that patients don't feel the pain of taking out money from their pocket? It's a long way to go to do that. But our goal is to make high quality healthcare affordable. That's our goal. So in that process, I think we also will learn a lot. But I think people also have to understand that healthcare is not cheap to run. Extremely expensive. And because we are running it, we realize how expensive it is to run. Na?
nay ashiba maji empathy Aria pilambana nisung ka asusipay ng feelings ang data iba isa pinyak ba iba ji kanga sa tung dibang diba ka manay ashiba nung jiodang niya asisimzer serano youngerson nung turn look aruba changa surgery tarut sukuma yang lut sama nay pilamber
yastang ba ma healthcare no what do you see in the future iba ji healthcare ji bo tambilan chi ba ji thati athalukter healthcare ji chungli no mani word ji but technology na iba ji it is healthcare runs on technology nang shide tana sang AI arrow na artificial intelligence arrow the artificial intelligence will take up medical field in a big way asang yanabo who knows 50% of the staff may not be needed now for example AI take over us so now AI then incorporates muziki kha kam nang bo in the long run patients at my baji it'll be more beneficial in resources. Ta iba ji something ono ki iba along ji iba direction ng order ono ka. For example, tango ni na ultrasound ali nga ultrasound machine ya AI enabled. Clear endoscopy as no tanas ng endoscopy machine na AI enabled sa liya. In example ni sino ba ji gastroenterologist ka endoscopy akya ya compare akiba experience ji tasan ka endoscopy si kuda nga maoksa. Tas compare na endoscopy inyak no nga the chances na tashita ka mupudit sa ji kanga high. So nung may ko ng AI amshida paano algorithm ng amshir siya, it gives you the clinical efficiency of a 20-year experienced doctor, for example. Na AI amshino. Asang yan nawi ji kanga sa angoza. Tanga technological features as nung in case of surgical technologies or surgical modalities or surgical interventions at nung iba ji nok tanga every now and then nok change sa lang later. So nok earlier tang urologists already nok South Indian nong and paano ko tangali manong dang teach sana for example teaching and practically saywa taiba is there and all this actually it's at our doorsteps for example but we just have to ashibama make it feasible for people to come also.
Sir, ne muziki nongdang ni na mapa achak siyang idang tukser sa kitang nung na hobbies like udang animal husbandry or any kind of things that you do apart from your life in the hospital.
The one thing ni realizes ba ji asnok sentiuset asnok katngali ba ji mabang time na and mabang ji bo mipamar that every day spends hour kasi ba ji kutang mipamar so iba ji it is hit me very hard iligaro that mabang ji senti the most precious commodity liya and nanigas nga what am I interested in so besides being a doctor I love animals I love gardening I love plantation I like going on small hunting trips na fishing I like walking I like traveling I like cooking as a matter of fact I'm a very passionate I wouldn't say chef but I love cooking and pretty much I can cook most dishes so if I was not a doctor if I'm going to change my profession I'll run a restaurant in MOKOKCHUNG.
Kadang changa diba dang tangan zaka tinyak diba ay ka dang libay na express as diba ji kanga changa diba angaw ko serano asunok naga shisa liyo kerdem medical field ko book azanga ay nakalir anong jinaya parnok nam kichi titiyo pa den kuma achong masuner
ni last year industries department no unnati atma parnaki meeting chatpa no ni atin edakchi angamitser parnok industries no i siang shi the word reverse drain na the reverse drain dasbaji mga sidang listen niya jibas nong asnok itimba chinauze pilamer na mokshong tokser dimapur tokser guwahati tokser delhi hour so mipa sa tangali madang pushour tangali maji asnok matachong bada pilamer hour so no ni pilamba jibo especially for healthcare naganor healthcare no alier tamiabo pili mai mi powers mabang thong da pilamer because sinutse jibo wherever you are as a doctor na tumlo agazan yak nongbo sunjibo udang you can earn na so no if you want to serve your people if you want to serve your parents if you want to serve your brothers and the only way is to come back and ashibama it's not very easy pili manong are suddenly said less but the greatest blessing you can give or the greatest gift you can give back to your people is coming back and serving them and I would like to encourage especially if there are any doctors or in the healthcare profession working remember that ultimately home is where your heart is.
Kangalang tungtipang una kanay ajak tang shiwo aje I hope that iba ja janga one or the other will get encouraged Serano nai ne muziki achanga ne pur demnem temang ane balutse tiari dak alaga ano tarutsa sushi kichi sinmang yutze zayimlar.
Iba hospital nyak pa ya urbang nong it's like a startup. And startup can be anything. Pandukan kalabok nong startup, na bakery kalabok nong startup, workshop kalabok nong startup. But the bigger the project it is, the more expensive it is. So ni ba hospital yatan zak sumabang nong isong ay guy, especially abroad nong, are you mad? Does she? Are you crazy na? Why would you want to do something like that? That's why she. It was not to discourage, so no, it's a reaction. Na? You want to do something crazy, it's a reaction. But I want to tell people, if you have a dream, na, if you have a dream and if you have a genuine interest na, for serving people, you shouldn't be afraid. That's the testament I want this hospital to be also, is that sometimes you have to be crazy, a bit mad, a bit eccentric, but nonetheless you should do it. And above all, when you're doing it, you should trust in God. And that is what I would like to leave. I don't know, 50 years down the line, but that's my intention.
Thank you so much, Sir Amanger. Singer mi nunuk nukla nungji pa tumuazi Sir pa tuka tenangda unuksar sa dama jaliza. Nidin changra dumadang sinsak sim akia aruku tatam sa udang ano nai radio angar damden na table nungi anima alizi zizi tumeditzi misira ya anga tatakziner dalira dam sadap nung kangadang tachungaszi.
It'll be more a personal thing, na tangashiba. So personally, one thing a person needs is discipline. Na? Discipline means you have to follow certain decisions. Na yang luwa decisions, whether you like it or not. Discipline na so unless na life no discipline malinong bo, it's very difficult to do anything. Na it's a struggle. For example, just eating breakfast every day at the same time, or getting up every day at the same time, or even making your bed. It's just they don't think, they don't see. So I think discipline is an important factor in life that we should inculcate. Second is balance. And balance is sometimes very difficult to achieve. Because now certain things you like more, na? But balance, family, work, hobbies, all this needs a balance. And if you don't have that, I think you still will struggle with many things. And for me personally, I think because I'm a Christian, I think you need to have that in your life, to make your life work, because it has worked for me. So iba yang shiner.
Thank you. Naina tangadat banungi. She says that chungagi share subadama kanang pilara. Asunuki Dr. Sungti, Anava Hospital Surgeon and MD, padan parnuk nukladan kalami pi nupurdam asushi inyak sabaji tungdipang aser tamang dan timiyim no inyakse da asaba tangadat banung achimdakar sinsak sentachung akaba angashiuku ibaya AKASHVANI MOKOKCHUNG.